Well, I feel a little awkward doing this because I'm pretty sure I know less about this topic than literally every one of the 270 people currently listening, and certainly all of the people who've spoken before me. I do not have ME. I don't have long COVID or any related chronic illness. I'm also not a doctor, but thank you for the promotion. I do, however, know about journalism and about stories, so I'm going to talk about that today, starting with the story of how I became part of this world. I've been trying to trace that back, and actually, I think it begins in 2018 when I got an email from a stranger named Sarah Ramey. We had communicated exactly once before on Twitter. She liked my book, I loved her music, and her email said, I have a serious health condition. I've just moved to DC. All the people I know in town have recently moved away, and this is absolutely mortifying, but will you go on a friend date with me? I said yes, and we almost immediately became really good friends. In 2019, Sarah sent me a copy of the book that she had been working on for a decade, The Lady's Handbook for Her Mysterious Illness, which describes her experience with ME and complex regional pain syndrome, the shocking mistreatment she experienced as a result, and the similar problems that millions of other people go through. The book is a monumental feat of storytelling. It helped me understand my friend better. It opened my eyes to this entire category of medical problems. It changed the way I think about the relationships between patients and the healthcare system and what it really means to think about health critically and skeptically. It primed me for what was to come. In the early months of the COVID pandemic, as I'm sure you all know, the received wisdom was that COVID was a disease that either hit you so hard that you ended up on a ventilator or was so mild that you got better after 2 weeks. But in the late spring, I started seeing trends that didn't fit with that narrative. First, and closest to home, my sister-in-law Meg got COVID, and after a number of weeks much greater than 2, she still had COVID. Fiona Lowenstein and Mara Gay wrote op-eds in the New York Times about their similar experiences. Felicity Callard wrote an amazing piece in the Somatosphere blog about what mild cases really can be like. Paul Garner wrote about his persistent symptoms in the BMJ. When I interviewed researchers about these patterns in May 2020, no one I spoke to knew about them. One of them said, that's very unusual. But it wasn't, not at the time and not now. It wasn't unusual to people who already had ME and other post-viral illnesses who knew full well what was going to happen once the new coronavirus started spreading. It wasn't unusual to the huge number of people who were experiencing what we now know as long COVID and were already starting to form the support groups that are so prevalent today. I published my first piece about long haulers in June, and that was read by at least 1 million people. I've written several pieces since on long COVID, and I know from the messages that I've received and from Nisha's wonderful talk, thank you, that these pieces have made a difference. They've helped people to figure out what was wrong with them. They've helped them to find community, to feel validated at a time of mass gaslighting, and to show their doctors, employers, and families that what they described was happening to them was real. I'm enormously proud of these pieces, but what I want to emphasize through all of this is that none of them would have been possible had the community not spoken up for itself. I would not have understood what was happening or drawn connections to ME and other chronic illnesses had I not read Sarah's book beforehand. Her words, your words, fueled my words. Your work allowed me to do my work, and in so many different ways. And first, and I really cannot tell you how useful this is to a journalist, there were names for the condition and the people who have it, and they were simple, evocative names. Eliza Perego coined long COVID, Amy Watson coined the term long haulers. And second, there was research. Like already, the patient-led research collaborative had somehow managed to do an entire goddamn research survey that asked tons of interesting questions and had tabulated and published all the results by May, while they were all sick. That's just a monumental feat that allowed me, it gave me concrete information to use in my pieces. The third, people from the ME community were already explicitly drawing connections between long COVID and ME. I can't remember who it was, but someone I followed, and it was almost certainly Sarah Ramey, retweeted Jen Breer into my timeline, which is how I became connected to this community, and which is why from my very first piece on long COVID, I explicitly made the connection to ME very clearly. For a recent piece I wrote about people who are grieving loved ones lost to COVID, an anthropologist named Sarah Wagner told me that after atrocities, wars, and conflicts, it's often bereaved family members who have to fight for recognition and reconciliation, despite the immensely heavy burden that they already are forced to carry. When it isn't politically expedient, Wagner said, for those in positions of power to commemorate the deaths and extend forms of reparation, it falls on families. And that's what I see here in parallel. All of my work draws from the efforts of people who have had such little energy to spare and were heroically using that little energy to advocate for themselves and to tell their own stories. Really, all I did was to believe them and listen to them. I do think that there is an important line between journalism and advocacy, and that the former must be different to the latter. But that doesn't mean that we cannot treat these stories with respect and care. When interviewing people with long COVID or ME, I recognize that the effort comes with a substantial cost, physical and mental. And I always say up front that if people need to stop the interview at any time or to postpone the call, they should let me know. I try to ensure that my pieces center patients and their experiences. And though they may be suffering, they are very much the protagonists of their own stories, people with power and agency, not subjects of pity or the passive beneficiaries of medical aid or scientific research. I use the term long COVID instead of PASC or PAX or whatever horrendous acronym scientists have deigned to coin because it's inclusive and it's what patients came up with. I've treated long haulers as the experts on their own condition because they are. As awareness of long COVID has grown, I've seen a growing number of journalists centering the academics who've latched onto this area, with long haulers merely used as a framing device at the top of a piece. And this is wrong. It's wrong because the long haulers I've spoken to, including many you've heard on this call, people like Angela and Lisa, know much more about their lives, their experiences, and the science of their illness than any academics I know do. For me, all of this started because I said yes to a random friend date and then listened. Don't underestimate the power of small acts of kindness or little moments of connection or of telling your stories. I don't know what the future holds, but I do know that it is crucially important for people like you to keep telling your stories and for people like me to listen to them. Thank you for having me.